TUV leader Jim Allister with us this morning. Jim, good morning to you.
Good morning.
The reality is the executive is trying to save lives, Jim, and they do not think it is safe to give dates. They clearly have not given any data in this document, but what they are doing is protecting life by keeping us locked down. And that is ultimately the most important, is it not?
Of course, protecting lives is important, but we also, at the end of this, have to have an economy. And I think you put your finger earlier on the key flaw in this document. It uses a lot of cliches about being data-driven. But you can't say you're data-driven and then conceal what the targets within the data are in order to open things up. You know, if you're data-driven, for example, on hospital admissions, what's the target which is the trigger to move you to the next stage? If you're data-driven on the number of ICU beds, what's the target that triggers it again? If it's new cases, if it's deaths, if it's the level of vaccination, what are the targets that allow you to move from stage 1 to stage 2 to stage 3? Those are all concealed, and those are concealed, I believe, because it's just a mantra to cover the fact that they can't agree on any of that. And, you know, it's easy to talk in cliche terms about being data-driven, but, you know, it's been likened to a sat-nav. What sort of a sat-nav is it? If it doesn't tell you what route you're taking and when you're going to get there, it really is a bit of a con, and it's just an appearance to be seen to be tackling a situation while all the time not tackling it and interspersing it with huge gaps of 4 weeks before anything's reviewed, and within that, no information on what the targets any of the data is.
Well, that's not true. The executive, and remember this again, when you hear the executive say that they will review things every 4 weeks, that's not true, because they have also written into the document that they will review it at any time of their liking. So it's not necessarily, it's at least every 4 weeks, but they can review it at any time.
Well, I understood that to mean that various matters were going to be put into regulation, and there would be a statutory obligation to review every 4 weeks. Just as it used to be every 3 weeks, now it's been stretched out to 4. That was my understanding of that. But whatever it is, on what basis are they going to review it? What are the targets within the data? You cannot say it's going to be data-driven and not tell anyone where you need to drive to on the data in order to get some relief. That's the key flaw in this document. And I think that's a flaw that's there because the truth is they can't agree. To talk in this mantra terms about being data-driven, it's just a cover to allow more indecision and disagreement within the executive.
It's easy
sadly what we've had to date.
It's easy for you to talk about indecision because you're sitting on the edges. So what would you open now?
Well, I would open our schools, absolutely, all of them. I think that our kids have suffered immeasurably. I think we are being very detrimental to their futures. You take a primary school.
Well, the executive have said they're going to aim to open schools after Easter. All pupils in schools.
Why aren't they opening next Monday?
How many lives would that cost you?
We've had this discussion where we have this lunacy of you hokey-cokey P1 to P3 in for 2 weeks. You take them out so that kids in another school, in a different cohort, can go into school. There's no logic.
Okay.
That's
so
utterly absurd.
So the TUV...
I would open the schools now.
Okay.
So
the TUV would go against the Chief Medical Officer?
Well, I think when you say something to the Chief Medical Officer like, we are going to be data-driven, but you won't tell us what the data is or what the landmarks are in that data drive, then you are issuing an invitation to the Chief Medical Officer to just keep on ordering more tunnel as he's done in the past.
Well, what is the data,
I think that is a surrender of political decision-making.
Well, hold on. You tell me, how many lives would it cost? What's the modelling say if we did do what you want and open all schools right now? How many lives would that cost?
No, you shouldn't put it in those provocative terms.
I'm putting it in those terms.
Sorry, yes. Have you seen the Chief Medical Officer's data on that? I haven't.
No, they won't release it.
It's been concealed from public representatives.
They won't release it. I've been banging on for months. They won't release it.
Don't ask me questions about data that has been concealed from public representatives.
I'll ask you the question, Jim, because here's what it speaks to. Here you are presenting yourself as a responsible politician, wanting all schools open immediately, and you don't know how many people that would kill.
Well, I don't accept the premise that would kill. That is so pejorative and evocative that it's unworthy of you, Stephen. You cannot say that. Where is the data that enables you to say that it would kill anyone? You know, you don't challenge me about data if you have no data yourself. Where's the data that would say opening schools would kill a single person?
Well, I would expect that it's a fair question. That clearly what the Chief Medical Officer is doing is advising against opening schools immediately, all pupils immediately, because that would lead to a higher infection rate in Northern Ireland,
you would expect.
which would lead to a number of deaths because the population is not totally vaccinated yet, because there is still pressure on the health service. Presumably that's the logic behind what he is doing. What else would you open? When would you open shops again?
Well, no, that's not just apart from your initial thesis. You say, I would expect. No, you're the man who's saying...
I said I would expect to ask the question.
You're the man that's saying, give me the data for this. I'm saying to you, give me the data for your expectation. You cannot tax me with the issue of data if you can simply make wild statements like how many people would that kill,
here's for example,
and you don't have any data to back it up.
Well, here's for example, I think it's